I talk about skincare with all of my patients. Historically, as surgeons, we never really learn much about skincare, and it makes absolute sense to recommend good skincare for our patients to enhance their results. So Vivian, we've reviewed your medical history. What is it that brings you here to this consultation? What don't you like about your appearance?
Well, I'm finally looking my age.
Show me what bothers you the
So
most.
I guess I'm looking mainly at the droopy eyelids. I've got the parentheses going on right here. And I've got, of course, the turkey neck, and then I've got all the brown spots everywhere.
You know, all of that is all consistent with being 55, and you know, you've shown damage that happened 20 years ago, and these are the things that we can address. To start off, I'd really like to talk a little bit about how we get to where we go and what facial aging is all about. We age 3 different ways. Our skin ages, we lose volume as we age, and our skin gets lax. The skin loses the collagen support. It loses its elasticity, and consequently, as it loses that elasticity and vibrance that it had, things slide downhill. So I like to use the analogy that facial rejuvenation is a lot like making a bed. When we make a bed, we plump up the pillows and put them in the right place. That reestablishes the midfacial volumes. We tuck in the sheets, and that smooths the jawline and takes that extra skin out of the neck. But if you make a bed with a wrinkled, stained sheet, regardless of how tight you pull that sheet, you still have wrinkles and stains. So it's really important for comprehensive care to do something to improve the quality of the sheets as well as the surgical results.
Wow, I never thought of it that way. It's a good analogy.
As a primary reason that you're here, it's certainly for a surgical correction. But to achieve a complete facial rejuvenation, I think skincare is really important to protect your investment and to really make it all look good as well.
So the skincare can make that big a difference? So you do the surgery and then you're maintaining it with the skincare?
We can improve the quality of the skin, and if the skin is thicker, if we can improve that carpet pad of collagen underneath the carpet of the skin, then you can make your skin softer, more lustrous, give you the luminosity that you're looking for, help flatten some of those fine wrinkles, and make the skin more elastic so it performs better. And that is all very important for a complete facial rejuvenation.
I see. So it's not one or the other necessarily?
No, not at all. With skincare, not all the answers are surgical. When you do have skin damage with the pigmentation, with the deep wrinkles, the fine wrinkles, you know, here's sort of a classic presentation of a woman who a lot looks worse than you. You look great. But you know, she's got the hollowness in her cheeks, she's got a little puffiness in the lid, she's got the wrinkling, the pigmentation changes. So with skincare, including Litera, which is a great SkinMedica product that helps decrease the brown spots and improve the luminosity of your skin. That can help clarify your complexion. TNS Essential Serum for the quality of the skin. Then we reestablish the volumes surgically. We redrape the skin and reposition the skin surgically, so it gives us a complete comprehensive care.
Wow.
As we're developing a personalized skincare program to help improve the quality of your skin, we really recommend a method called the GRASS method, and that involves growth factors, retinols, antioxidants, specialty products, and sunscreens.
I'm always hearing about all these different products, so why are you recommending these products?
SkinMedica is all about the science. It's the first company I've really been able to believe in because they've proven to me that every ingredient in every product has a reason to be there and that's effective. So when I recommend SkinMedica products, I know that they're going to be beneficial for the patient. I was impressed when SkinMedica published a paper that showed the efficacy of TNS Essential Serum, and it caught my attention, and I said that this is not like skincare used to be in the past. This is something new and different. So I got a bottle of TNS Essential Serum, started using it. Within 2 months, my wife noticed a difference and stole my bottle, so now we both use it. And by using them, I know that they work. Since then, I've been a real believer, and it's really made all the difference for myself, my wife, and all my patients, because it's really improved the quality of the skin.
Well, if you and your wife use it, that really says something.
Absolutely. So we've reviewed most of the non-surgical approaches towards improving the quality of your skin. Let's talk about some of the surgeries that are available. This is a woman who's in a similar situation. This is about a better comprehensive result for our patients. 2/3 of a facial rejuvenation result are surgical. The other third is skincare. And I found that advising the patients to really get in a good skincare program enhances their surgical results. So you're 8 weeks post now. Things are really coming along nicely. You're right on schedule. Looks good. What a difference. What do you think?
I'm so happy. The brown spots are just so minimized. It just looks so much better. It's fresher and just, it seems to kind of glow my skin.
Do you have any concerns?
The only concern might be just this one scar. It's a little red and it feels a little thick.
Okay. At 8 weeks' time, this is when scarring is at its worst. So the scar goes through a phase when it's quite immature. Using scar recovery gel twice a day will speed that process along, decrease the inflammation, decrease the redness, and make those scars less apparent. Scars are manipulatable with product for 6 months. So we like to have you keep that up, and that'll give you the best possible scar.
Good to know.
Okay.
Good, I'll get on that.
Yeah. And how about the other products?
Oh, they're fantastic. I just can't get over how different it looks.
Really has made a big difference.
It glows.
It does. And it's given you some of that elasticity. The fine lines are starting to resolve, and it's just getting to kick in now, because you'll notice over the next months that it will continue to improve.
That's great.
The TNS Essential Serum has not only protected your skin, but it has improved that quality. Right. The Litera has done a nice job with the brown spots. So remember that program, that method for you, which is the growth factors, the retinols, the antioxidants to prevent further injury, the specialty products, the Litera. And you can use that Litera on your neck and décolleté area as well.
Very nice.
Okay.
Yeah, I was going to address those at some point, but that's perfect.
Above all, your sunscreens. Make sure you protect that investment that you put in your face.
Definitely.
So Vivian, I would like to see you back in 6 weeks to 8 weeks or so, just to make sure that you're continuing to make your progress.
Okay.
And make sure that you're using that scar recovery gel twice a day so those scars look better for you.
Definitely will.
All right, so you can check out at the front desk and make that appointment. Call if you've got any questions. But things are really doing The reason that involvement with SkinMedica is easy for me is I've been so impressed with the science behind these products. Showing how these work biochemically and then seeing the effects on the patients has been remarkable. And I get excited about the products because our patients do well on them. It gets the patients continuing to come into the practice, and these basically help the bottom line.